Ever wondered, what is leukemia and how does it affect our body? Let's unravel this mystery together. Leukemia, at its core, is a type of cancer. Now, we're all aware that cancer is a group of diseases characterized by abnormal cell growth. But what makes leukemia unique is that it specifically targets our white blood cells and bone marrow. Now, our bone marrow is a soft, spongy tissue found in the center of our bones, and it's here where our body produces white blood cells, among others. These cells are the superheroes of our body, always ready to fight the villains, infections, and diseases. But when leukemia strikes, it's like a plot twist in our body's story. The cancerous cells begin their life in the bone marrow, but they're not your typical white blood cells. These are rogue cells, growing and dividing at an abnormal rate, overwhelming the healthy cells. As these rogue cells multiply, they start to spill over into the bloodstream, spreading to other parts of the body. This invasion by cancerous cells severely impacts the body's ability to fight off infections. It's akin to having a superhero team where the villains have disguised themselves as the heroes, causing chaos and confusion. And just like in any good superhero story, recognizing the villains is the first step to defeating them. But leukemia isn't a straightforward enemy. It's a complex disease with multiple types and subtypes, each with its own unique characteristics and challenges. It's not a one-size-fits-all situation, making it even more crucial to understand and recognize. So, to sum it up, leukemia is a type of cancer that starts in the bone marrow, affects the white blood cells, and can spread to other parts of the body. It disrupts the body's defense system, making it harder for the body to protect itself against infections and other diseases. Leukemia is a complex disease that impacts the body's ability to protect itself. But knowledge is power, and understanding leukemia is the first step in the fight against it. You may not know it, but there are different types of leukemia. Broadly speaking, leukemia is categorized into 4 main types. Each type is unique in its own right, affecting the body differently and having its own set of characteristics. First up is acute lymphoblastic leukemia, or ALL. This is the most common type of leukemia in young children, but it can also affect adults. As the name suggests, it's acute, meaning it progresses rapidly and requires immediate treatment. ALL affects lymphocytes, a type of white blood cell that plays a crucial role in our immune defense. When someone has ALL, their bone marrow produces too many immature lymphocytes, which aren't able to function properly. This overproduction can crowd out healthy cells, causing a range of health problems. Next, we have acute myeloid leukemia, AML for short. This type can occur in both adults and children, but it's more common in adults. AML affects myeloid cells, which are precursors to red blood cells, platelets, and certain types of white blood cells. In AML, the bone marrow produces abnormal myeloid cells that can't mature into functioning cells. Like all, AML progresses quickly and requires prompt treatment. The third type is chronic lymphocytic leukemia, or CLL. Unlike the acute types, CLL progresses slowly and typically affects older adults. CLL also involves lymphocytes, but in this case, the bone marrow produces too many abnormal, mature lymphocytes. These abnormal cells take up space that would otherwise be occupied by healthy cells, leading to a weakened immune system over time. Lastly, we have chronic myeloid leukemia, CML. This type is rare and it affects adults more than children. CML involves an overproduction of abnormal mature myeloid cells, much like CLL, but with a different type of white blood cell. CML generally progresses slowly at first, but can shift to a more aggressive phase if not treated. Each leukemia type has its unique characteristics and impacts on the body. Understanding these differences is key to diagnosing and treating this complex group of diseases. Now you might be asking, how do I know if I have leukemia? Well, it's not always straightforward, as the signs can often mimic those of common illnesses. However, there are certain symptoms that, when persistent, might point towards leukemia. One of the most common is fatigue. This isn't just your run-of-the-mill tiredness. We're talking about an overwhelming sense of exhaustion that doesn't improve with rest. It's a fatigue that can interfere with your daily activities and is often accompanied by weakness. Next, we have frequent infections. Leukemia can weaken the immune system, making you more susceptible to infections. If you're finding that you're falling ill more often than usual, it could be a sign. Then there's the problem of bleeding or bruising easily. This happens because leukemia affects the blood's ability to clot. So, something as minor as a bump or a scratch could result in a bruise, or even prolonged bleeding. And let's not forget about unexplained weight loss. If you're shedding pounds without trying, and it's not due to changes in your diet or exercise, it's worth investigating further. Now let's pivot to risk factors. Some things can increase your chances of developing leukemia. These include exposure to certain chemicals like benzene and formaldehyde, which are found in everything from gasoline to pressed wood products. Radiation exposure is another risk factor. This doesn't just mean radiation from nuclear power plants or atomic bombs, but also high doses of radiation from medical treatments. Genetic disorders, such as Down syndrome or Klinefelter syndrome, are also seen as risk factors. And lastly, if you have a family history of leukemia, your risk is slightly increased. But remember, having one or even a few of these risk factors doesn't automatically mean you'll get leukemia. They simply raise the odds. Also, many people with leukemia have no known risk factors. Being aware of these symptoms and risk factors can help in early detection and treatment. So keep an eye out and always consult a medical professional if you have any concerns. Diagnosis and treatment of leukemia can be a complex process. Let's start with the diagnosis. Leukemia often comes to light through routine blood tests, even before symptoms begin to show. If leukemia is suspected, doctors usually conduct a series of tests. These can include blood tests to check for the presence of abnormal white blood cells, and bone marrow tests to confirm the diagnosis and determine the type of leukemia. Physical exams are also crucial. Doctors examine patients for signs of swelling in the liver, spleen, and lymph nodes, which may indicate leukemia. These tests provide a comprehensive picture, helping doctors determine the type and stage of the disease. Once a diagnosis is confirmed, doctors turn their attention towards treatment. This is where the complexity steps up a notch. The treatment plan depends on several factors, including the type and stage of leukemia, the patient's age, and their overall health. Chemotherapy is the most common treatment for leukemia. This involves the use of drugs to kill leukemia cells. It can be a challenging process, with side effects that range from nausea and hair loss to more serious complications, but it's often highly effective. Radiation therapy is another option. This uses high-energy radiation to target and destroy leukemia cells. It's often used in preparation for a stem cell transplant. Speaking of stem cell transplants, they are another potent weapon in the fight against leukemia. They involve replacing the patient's diseased bone marrow with healthy stem cells from a donor. This allows the body to produce new, healthy blood cells. Targeted therapy is a newer, more specific approach. It uses drugs that specifically target the abnormalities in cancer cells, causing them to die. This method can often have fewer side effects than traditional chemotherapy. Though a challenging journey, effective diagnosis and treatment can significantly improve survival rates. And remember, while each journey with leukemia is unique, every step forward in diagnosis and treatment brings us closer to a world where leukemia is a condition we can overcome. Leukemia is a serious condition, but knowledge is power. As we wrap up, let's revisit the key points we've explored about this impactful disease. Leukemia, a cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. It's a complex disease with a broad spectrum, not one, but many types, each with its distinct characteristics and implications. Acute or chronic, lymphocytic or myelogenous. These terms may seem overwhelming, but they're crucial in comprehending the disease's nature, prognosis, and treatment approach. We then delved into the symptoms and risk factors, from fatigue, fever, and frequent infections to unexplained weight loss and easy bruising. The signs can be subtle and often easily overlooked. Risk factors, on the other hand, range from genetic predispositions to environmental factors and certain medical treatments. Knowledge of these symptoms and risk factors empowers us to be vigilant about our health and seek medical attention when needed. Diagnosis and treatment of leukemia. A journey that can be daunting but is made easier with understanding. From blood tests and bone marrow exams to imaging and genetic tests, the diagnostic process is rigorous, designed to provide a detailed picture of the disease. Treatment, then, is tailored to the type and stage of leukemia, the patient's overall health, and their preferences. It can encompass chemotherapy, targeted therapy, radiation therapy, stem cell transplant, or a combination of these. Leukemia is a serious condition, but remember, it's not a lone battle. Medical advancements continue to evolve, offering hope and improved outcomes. Understanding leukemia is not just about recognizing its medical aspects, but also acknowledging the resilience and courage of those battling the disease. Knowing about leukemia not only helps in early detection, but also in understanding the plight of those battling the disease. Stay informed, stay healthy. And remember, in the face of adversity, knowledge is our most potent weapon.